Thank you for coming to 1 Million Cups. I just want to talk about a milestone that's coming up next week. I think it's time to get a birthday cake because we've been doing 1 Million Cups for 6 months next week. And this has really grown into pretty much the only consistent thing that I do on a weekly basis. So it's been a lot of fun, and we've had 50 entrepreneurs, 50 startups come through 1 Million Cups. So I'm really excited. Thank you for your support. Thank you for coming out in numbers. Our first entrepreneur today is Brian Gruber from Lucky Orange, and he's basically got a website developer's dream tool package, and he's here to demo the product. It speaks words, and if Diana Cander's in the house, she told me she's got a testify over here. Yeah, she launched Lucky Orange, I think, a couple weeks ago on a website and has just had awesome success with it. So I'm going to hand it over to Brian and let him tell you all about it.
Great. Well, thank you very much for having me. This seems like an amazing forum. And I'm pretty much just going to kind of demo it and let the tool speak for itself. So, well, Lucky Orange is a real-time analytics, usability, heat mapping, polls, chat, everything kind of in one super tool that I created when I was building a lot of websites, and I thought this is something that I want to have on my website. So what it is you just put a little bit of JavaScript code on your site, like a Google Analytics, and then it enables a whole bunch of functionality, and I'm going to show you that right now. So this is the Lucky Orange dashboard. What you're seeing now is traffic to a website that I also own. It's a baby naming website. It's called birthvillage.com. And this is live traffic on the site right now. So you can see there's 105 unique visitors with 141 tabs open, ranks by countries and regions, plotted on a map. This is kind of fun. If you have a projector, you can full screen the map. Leave that in your waiting room, office, whatever. Over here you see the top pages. Baby boy names are really popular right now. Top keywords, this is where people are coming in. Apparently this name is popular right now. The sources, also Google will be segmented by the type of Google. So Google India versus standard Google, United Kingdom, Arab Emirates. Interesting to note, India loves baby names. I don't know why, but they really love baby names. It's my biggest population on this website. And as you see visitors coming through the site, they'll start to appear here. Again, this is real time. So as people visit the site, you'll see this updated. In the Visitors tab, you can start to drill down specifically to every single visitor on your website. We can, again, see the referrers, the name, the page they're on, how long they've been there, the number of tabs open, where they're from, the type of browser and operating system. And you can even see if they're active or not. So active means they're actually moving their mouse around or clicking something or engaging with the site. This person's typing something. And then we have a little feature right here called Spy On, which I'm going to demonstrate to you on my own browsing session. So right now I'm switching over to luckyorange.com. So this is my website. Imagine that this window is going to be a visitor, different visitor than myself. Over here I see there's 2 people on luckyorange.com. Feel free to go to luckyorange.com right now and watch yourself appear. So I'm going to click Spy On. Can you see the 2 windows? It's the same size. My mouse is moving, and you can see my mouse moving. So you can actually watch people use your website. If I scroll, you'll start to see the page scroll. My mouse path is being plotted. If I start clicking, you'll see the clicks. And you don't have to do this in real time, but this is kind of real time, maybe a second delay. It'll automatically record these for you. So you can come back to your website later and play things back. As I move from page to page, everything updates as well. And in the recordings, here's automatically you're going to get those types of recordings. And you can watch them similar to that Spy On, but playing them back at a faster rate. So here's one, I don't know who this is, but you see somebody's mouse moving along the screen. I could have a few options here to kind of, well, they're gone. They didn't do much. Let's find one that has a little bit more activity. Here. Don't know what this is. This, again, is somebody visiting the site. They're idle for a few more seconds. Tick-tock, tick-tock, and then they will start moving. If I click this, I can skip all the idle times. So now I'm watching it much faster. I could speed playback up 4 times, 10 times, make it really fast. And you can go back to each of the different sections. It'll record whatever the website owner wants it to record. So I could say, don't record keystrokes, do not record clicks, or mouse movements, or scrolls. It is up to the website owner to decide how much or how little to record. All password fields are never sent or recorded. You can specify certain input fields to be considered sensitive, and those will never be sent as well. So there's a little bit of privacy concerns there, but the website owner has a lot of control. And that's kind of the recordings. You can gain a heck of a lot of information just by watching somebody use your website, as I'm sure you've all seen. Bring someone from the hallway, hey, use my website. And then they fumble on something and you say, oh, you're just silly. You don't know what you're doing. By the 5th person to do the same thing, you realize there's really something wrong. So this does the same type of thing. And a lot of people are using it to a great effect. The tool also offers chat, so you can have live support chat. Right now, no one's online, so I have a little offline away form. This is also part of the product. And if I just say that I'm available to chat, then a little button should appear in the bottom right. Chat with developer. You can customize this, and then you just go ahead and chat with people. And you say, hi. The chat will follow you from page to page. So it'll rebuild the conversation so that you don't have to just stay on one page. And then if you really want, you can spy and chat at the same time.
That's awesome.
So that's handy. We also offer polls, which are very quick kind of questions just to get a little bit more information. It'll look similar to the chat window. I set up a poll on the sign-up page to pop up after about 15 seconds. And you can control where the polls pop up. You can say on this page, that page, many pages, only for this country or that country. In a few seconds, hopefully we'll see a poll pop up. And there it is. Is there something preventing you from trying us out? This is kind of open-ended. People can leave comments. And you get a lot of information with a question like that. I originally had the sign-up page not use a form. Instead, I just put up the lucky orange code and said, here you go, here's the code, put it on your website, and everything is dandy. And people said, where's the sign-up form? I don't know how to sign up. So they actually needed a sign-up form. I thought I was eliminating that bottleneck, but they were expecting it. So I got that information from the polls. And we also do heat maps. If anyone has seen a heat map before, a heat map will take an aggregate of all of these recordings and figure out exactly where people are clicking on your page. This is going to be a little large, so it takes a few seconds. So this is a visual heat map of the home page based on some sample data. And you can see people are clicking this play button here. A lot of people are clicking this login versus this login, which is interesting. And some people were clicking over here and here. It just lets you know what elements people are interacting with. And I also have mouse movement and scroll depth heat maps. So mouse movements is similar to eye tracking, not 100% the same. But you can get kind of a feel for how people read your page, because people tend to move their mouse around as they read. So this would be mouse movements, a lot of attention over here, some over here. No one really interested in this message. And scroll depth will tell you how far down the page people actually get, including a little bit like of an average scroll depth. a lot of points there. So the 100% of people got over here, 87%. This is the average height. So that's kind of like a browser fold if you want to figure out where your fold is on your page, and kind of diminishing over here. And that is the tool in a nutshell. It does a heck of a lot of stuff I didn't tell you all about. I have clients from personal bloggers all the way up to Cirque du Soleil as a customer, and growing steadily. And I'm just kind of looking for feedback and help and figure out how to grow it some more. So I'm happy to take questions if that's the time.
All right, let's open up for questions, guys. Here. Let's pass the mic around.
I saw it briefly, but what's your revenue model? Is it a monthly subscription?
Yes, it's a monthly subscription. There's discounts for yearly or bi-yearly plans, but yeah, monthly. There's a free account that's kind of limited, but just monthly recurring. And I have a lot of members who just stay on for a very long time.
So are you building it for website developers or agencies, or?
I have tools for them. So I have website agencies that use it, and I also have just people, just personal websites that use it. Everything in between.
Cool.
Mm-hmm. Yeah.
So, awesome product.
Thanks.
Yeah, great product. I remember you showcasing it at Venture Fridays, and I was pretty blown away. What's the competitive landscape, and how long? When did you start this? When did you release it to the?
Right. So I soft launched it, I guess, January 2011. By soft launch, I mean I just put it on the internet and didn't tell anybody about it, and then just kind of saw what would happen. There was a lot of things not in the tool at the time, and I just added on. So probably was more serious about it. It's probably been a year, like of real development. The landscape, I don't think there's a lot of people doing this. I can, on one hand, name my competitors, but I picked a bunch of tools and put them all together, and no one has put all these tools together in one. Like, you'll have a recording company that does visitor recordings, but that's all they'll do. They won't have chat, they won't have heat maps, they won't have polls. So I can't find somebody that does everything. But individually, there's a few. But there hasn't been a problem yet.
How many staff members do you have?
This is the staff.
You're
it.
Yeah.
Are you looking at adding more, or?
So I have been working recently with another developer. I'm looking to bring him on. I'm about at that stage where I want to add another developer.
And are you fully developed? I mean, is there more things you want to add?
Yeah, there's a lot of stuff that I want to add. And scaling is an issue. So I have to handle whatever traffic any website that uses it handles. So if you have 10 million views a month and you put the code on your site, I now have to add 10 million more capacity to my server, because you're putting that code on every page of your site, and it's hitting my website. So it's an interesting challenge. Yeah.
So where are you located?
Downtown Overland Park.
Do you have servers there? Or?
No. I use Rackspace
Oh, okay.
for the server.
Same.
Yeah.
Where does the name come from?
Where is a great question. The true story or the fake story? The true story is Lucky Lime was taken, and I wanted, yeah. So I picked Lucky Orange instead. Yeah. I like putting two strange things together. I think it's an interesting mnemonic device, So hopefully it's memorable, and lucky keeps you, it's lucky. I don't know. That's just kind of, yeah.
We use Chartbeat,
Mm-hmm.
and they upgraded their system. Are you familiar with Chartbeat?
Yeah.
And they completely destroyed how useful it was.
Oh, okay.
But I think the challenge on the web user side is, so now I've got all this data, what do I do with it?
Mm-hmm.
Do you help companies or your clients figure out what to do with the data?
Right. Not currently. I have thought about that and charging something to interpret the data. I've kind of left that up to a lot of web agencies and just said, here's the tool, and if you want to charge a premium to interpret the data, you can do that. And some agencies are doing that. I don't have that right now. Yeah.
I find it funny how you're incognito and then you're spying on people at the same time.
Yes.
But a question that I think is going to be raised is, like when I think of Google, I think of how they kind of spy on you and then they put ads depending on whatever website you go to. And people call that an evil, especially when all of your search history is being looked at.
Yeah.
Let's say someone asks that question to you, what about spying on people and the
Sure.
the issues with that? How would you respond to that?
Yeah, it's a great question. It's a big concern. So I try to make the tools available for the website owners to decide. Well, first off, you can opt out of tracking. So if you visit our privacy policy and you click a button, you will not be tracked. Second, and I'm just adding support for the no tracking header. So I want to have it so that if you have the no tracking header enabled in your browser, you won't be tracked. And the other thing is website owners decide, do I want to just see mouse movements? Because there's no personally identifiable information with a mouse moving across the screen. It just helps them understand how people are using their website. You're correct. There is a privacy concern. I kind of put that into the website owner's hands and just give them the tools to make sure that whatever is personal or sensitive information does not get sent to the web. Yeah. Mm-hmm.
So, specific with mobile, are you who gets on there with a mobile browser? Are you what kind of information is coming through? Are you getting the carrier? Are you getting their name? Are you getting their phone number?
No. I don't get any of that information.
Okay.
I wouldn't want to grab that information. You'll get the type of browser they're using, the type of phone that they're using. There's minimal support for touch events. Still working on adding more of that. So you could see them, touch, pinch, zoom, or whatever. That's not there yet. But that will.
Do you have plans to get a mobile optimized site?
I'd like to. It will work on a tablet. It doesn't use Flash for the connection, so you can actually open this on a tablet and use the dashboard. Yeah. No, there you go. Mm-hmm. Well, let me go ahead. I'll come back to you. Yeah.
So I met with you a while back, and we've been using the product a while, and I just want to say it's a great product for anybody who has a website and trying to figure out if they're selling stuff or not selling stuff, and what people do. It's such an invaluable tool. If you make your website and try to figure out how far down do people scroll, trying to improve conversion and all those things. And for most of us who have, our own business, the difference in 1 or 2, 3% difference in conversion, maybe the difference of being in business or not being in business.
Right.
And this is the kind of tool that helps you figure that out. So I just strongly recommend it to everybody that
Thank you.
I'm a paying customer.
Nice.
An endorsement.
Go ahead.
How are you marketing it?
I'm not. This is it. I've really been trying to stay a little more low profile as I work out some kinks. And now I'm starting to think about more marketing. But it's been a lot of word of mouth. It was a cool enough product that I think people said, wow, that's neat, and they talked about it, and that worked. That did not work for my previous projects where I thought just word of mouth will do it, and it didn't. And I guess something about this is worth talking about. Yeah.
Do you have an exit strategy?
You can help me with that. Not yet. Yeah. I have ideas. Yeah.
It sounds like somebody's going to buy it.
I've had offers. Yeah. Okay. Yes.
2 questions. What's your background before getting going with this? And then 2, have you thought about applying for a program like Pipeline or any sort of startup incubator, something like that?
Yeah, the incubators I thought about, and I thought that it wasn't for me because of how far I've already kind of come on my own. But I just saw the Pipeline program, and I've been thinking about that. Haven't made a decision. My background, it is computer science. So I have a degree in computer science. I was building websites for many years, then I got bored of that, and I started doing dog training. And I worked with like aggressive, fearful, anxious dogs for about 3 years here. That's an interesting departure. And that was fun. Cesar Millan, yeah, dog whisperer. Okay, so that's what I was doing. And on the side, I was still working on my own projects like Lucky Orange. And then Lucky Orange kind of started taking off, and I put the dog training on hold. Now I'm doing this full time. Yeah?
Do you guys have any data on increasing conversion rates for e-commerce sites?
I have feedback. I don't have like exact reports. I have feedback ranging from like, we started using this and now we're getting like 300% more sales or stuff like that. And everyone kind of uses it differently. So some people only use the chat system, and for them that increases sales. Some people only use recording. Some people use both, or heat maps or polls. So you have your choice there. And each tool individually can really increase your conversions. Use them all and everything's great. Yeah. Yes.
So we use Lucky Orange. It's a fantastic tool. And I just wanted to share one more use for the product. For your pay-per-click campaigns, Google Analytics will tell you like who clicked on your pay-per-click campaigns and how many of those people made it to your website. You can see through the Lucky Orange platform what keywords they searched for, what they clicked on, and then the quality of those visits. So like how much time they actually spent on your site. So you can actually have very robust pay-per-click analysis by seeing which keywords that you're paying for are resulting in people coming in using your site.
Yeah, I had somebody tell me a story about that. And because you get the data so quickly and you see if people really care about it, they were able to just change their PPC campaign like within minutes of turning it on. It normally took them hours to get that data, and they've spent tens of thousands of dollars in those hours, and they just changed their campaign right away because they saw, so-and-so is coming in from this kind of keyword, and that's not at all what we want. So if you pay careful attention, you can save a lot of money.
I have another question for you.
Okay.
One of the things I think that you do that a lot of people should look at for others that have their own business is the fact that you're doing more than one thing. Mm-hmm. That was one of the reasons my company that I had before was so successful, is we had lots and lots of, everybody always asked who our competitors were, and our answer, like yours, was, well, it's either everybody or nobody. Mm-hmm. Because there's different people that do different aspects of what you do, but when you add them all together, you don't have any competition. Right. And so for a lot of us that have different businesses, I would urge all of you to take that same approach to say, well, if I add these three things together, now all of a sudden I have something that's very unique. Mm-hmm. And a lot of people, I always hope with my new business, like I hope people look at us and say, holy crap, that's complicated. I don't want to do that. Mm-hmm. Because there's just too much involved. Mm-hmm. Where if you're doing one little thing, other people can say, well, I can do that. That's no big deal. So that's kudos to you of thinking that way and continue to go down that path. And something I would urge everybody else to think about as well is adding the multiple pieces and not being a one-trick pony kind of product. Mm-hmm. So.
Have you considered, or maybe you already have, any kind of reseller or affiliate program?
Yeah. Yes. So I did launch kind of a white label plan, but I don't think it was what people were looking for. So I want to modify it a little bit, where you can take the logos off and have a custom login page. But I think the limitations were prohibitive. So I'm going to change those and make it a little more interesting. Mm-hmm.
So two-part question.
Yeah.
What's your vision for this ultimately? And also, I mean, you talked about you're kind of hitting a point where you're scaling, but I don't know. You said you're sort of facing some issues. So like, mm-hmm. What's your greatest issue in the next 6 months, and how can we be helpful to you as a community of entrepreneurs?
Yeah, it's a good question. Honestly, my vision keeps changing. Maybe it's not supposed to go that way, but I thought that I would want to stick with this company and grow it and have it for the long haul. And then some days I'm like, I want to sell it. And then, it just kind of changes. So I don't know if, let's say I had a few employees and grew it to millions in revenue. I don't know if at that point I'd say, wow, I really like working at this company. I don't want to sell it versus I've had enough. I just don't know because I like interesting projects. I like to work on things that I can kind of say, oh, that I want to do that. I want to do that. And as long as I have that fulfillment, I think I can work on this for the long haul. But so it kind of changes. What I would want in terms of help, I guess I need a little guidance in figuring out the right avenues to grow this product, how to do it safely. Like the privacy concerns, I really want to address those and make sure that those are solid. And just some guidance in getting it to the right place. Yes. Okay.
Another question. What's one thing you learned from training aggressive dogs that you can apply to growing lucky dogs?
Yes. Let's see. One thing. Well, I didn't train dogs. I trained humans. So I did learn a lot about customer service. Let's say my server is crashing, right? And that's a pain. There's certainly an essence of extreme panic that could set in that with the aggressive dog, when they're lunging for your throat. You have to figure out how to just stay calm and focused and just deal with the now instead of worrying too much about the future or the past. So I guess living in the present would be a huge thing that I learned from training aggressive dogs, just reacting really fast. So, yes?
What did you learn about training people that built into this tool?
That built into this tool. I learned that sometimes people are rarely honest with how they see themselves and how they explain how they use your website. So if you ask them, hey, how did you find me? On a form, and you might put a drop down that says Google, Yahoo, or whatever, and they'll just pick some search engine, even though that wasn't the search engine they found you from. If you really start watching people use your site, you'll see they're just chaotic and random, and they're just like, look at that, no, I don't want that, and I'll go to this place. And they don't work like you think they work, right? So see them for who they are, not how they tell you they are. And this tool can help you with that. Yes?
I love the tool. I wanted to know if I could talk to you afterwards about how to train my dog.
Okay, sure. I still love talking about that. Yeah. Sure.
Is that the second part? Is that you'll talk about dogs?
One day. TEDx, yeah. We'll do that. Great.
Awesome. We have time for one more question. Anybody? All right. Just give me
Okay.
Sorry.
Wait. Okay.
Okay, well, sorry.
Yes. Mhm.
You made me think when you said that people are a lot more random than you think they are.
Mm-hmm.
Well, that feels like it makes analysis even more hard, unless the analysis begins with presume that they're random.
I guess random may be the wrong word. Just not as predictable. So you might think I'm going to put this green button over here and it'll say buy now, and they'll click it. I'd click it. Why wouldn't they click it, right? But then when you watch them, they're not even looking at it, right? So that's the information you're going to get. Oh, they're looking at this other thing. They're clicking on a link that's not even a link. Why are they clicking on that text that's not even a link? Are they interested in that kind of text? That's what I mean. We can't really predict them as much as we think we can.
Yeah, so the other tool that you can use that helps with that is Google Analytics. Has a A/B testing deal.
Yes.
And it's nice to use that, and maybe in combination with this to see what people do and what works better.
Or Optimizely.
Yeah, we use Optimize as well.
Yes.
What is the correlation between where people are looking and where their mouse is?
I'm probably not skilled enough to answer that. I've seen studies that can come to like 60%, and other studies will be like 80%, and other studies says 10%. I just, when I watch people in real life, there's some people that really read with their mouse, and they will go over every single word as they're reading it, and other people put their mouse off to the side. So it's somewhere in the middle there, Mm-hmm.
All right, everybody.
Maybe a little bit too low.
Oh, sorry.
I would go back and look at your price model.
My price model, yeah.
$10 or $20
Yeah.
I think that's too far too low.
I agree. I'll pay more.
Yeah.
We'll pay more.
Grandfathered in.
I actually already changed the pricing and raised the prices. It was cheaper, and I grandfathered everybody in. Yeah, it's something I think about. As a technical founder, I think that's a flaw. I think that a lot of technical founders have, is that we just price it really low because we didn't pay for it. We just built it, you know. And yeah, you're probably right. It's something to look at. Okay.
It's my pleasure to present Richard Shaw from Vena and Wound Care Centers of America. And Richard reached out to me, and his company is fascinating. There's currently 90 million Americans in the United States, most of which are over the age of 50, that suffer from venous disease. And they're about to launch their first space in Westport and then have planned for 2 more spaces here in Kansas City. I'm not going to take up any more time, but Richard has a lot to educate you about, and hopefully you'll be able to support him and be able to relate. So,
thank you, Nate. Can you hear me okay? Yeah. All right. Well, as Nate said, that's who I am. I'm Director of Operations. Dr. Brockenbrough is our Chief Executive Officer and Chief Medical Officer, and we'd like to thank you for inviting us here today. Our company name is Vena and Wound Care Centers of America. Is a mouthful, so we shorten it to VWCCA. We specialize, let's see if this works. For some reason, it's not working now. Yeah.
Oh.
Okay, thank you. Okay. We're a specialty medical services company headquartered here in Kansas City. We hope to become a national company. Our first site, as Nate said, will be in Westport. We're going to have a second site in Blue Springs. We're actively looking for space currently. And we're in active discussions with our third site, hopefully by October, November of next year in Olathe, and it's going to be in a skilled nursing facility site. What makes us different is we're going to be identifying and treating all forms and manifestations of venous disease in an integrated manner. Right now, venous disease comes in a lot of different forms, and they're being addressed in fragmented ways and really very inefficient, and that's one of the reasons why the high cost of treatment is so high. Making services more readily available, the biggest, out of the 90 million people that Nate mentioned, when you think about that, that means over 2 million people in each major cosmopolitan city in this country. We have about 22. But really, many of them are in underserved urban and rural communities. There's no service out in Lafayette County, Cass County, very few in Clay, for example, in the Kansas City metro area. And there's practically none in the urban core. In all of this area here, there is no service at all. St. Luke's is probably the closest one, but if you go into Troost, you go into some of the blighted areas, there's absolutely no service. Swope Health doesn't offer it, and neither does Truman Medical. KU Medical doesn't offer this either. So that's a major problem. So we want to have an integrated service. We want to have mobile outreach programs available, which nobody offers currently. And we want to establish services on campus of retirement homes because up to 75% of folks in retirement homes, extended living, assisted living, skilled nursing facilities have this problem, and they're not being identified and treated efficiently and effectively. These are the 4 issues related to venous disease. It's a blood circulation problem. Chronic venous insufficiency, all that means is blood doesn't return back to your heart the way it's supposed to. Deep venous thrombosis, which is a killer, most serious event among this. Stasis skin changes. If you see people walking down the street in shorts and they have discolored legs, ankles, that's what that is. That's advanced stage of chronic venous insufficiency. and then it leads to stasis skin ulcers. And I have pictures for each one of these conditions for you to look at. Chances are, if you ask friends and family, they'll all tell you they know somebody that's got this problem. So the venous system primarily is peripheral blood returning to the heart versus arterial system. That's very simple. Okay? The reason why I became interested, frankly, to tell you a side story, is my father had this problem 30 years ago, almost lost his foot as a result. And that was my first introduction into it. And then I found out how prevalent it was, both among Asians and among certain groups of the population. The problem is very widespread. You're looking at 50 to 55% of women over the age of 50, and 25% of women in all age groups have this condition, okay, in some degree. 45 to 50% of men age 50 and over, and 15% of men in all age groups. Okay, so that's the same as heart disease. It's even higher than cancer. Okay? In 2012, there will be 100 million Americans age 50 and over, potential patients 50 million. So in the 20 to 22 urban centers in this country, major urban centers, of a million or more, you're looking at 2 million people per urban center. But again, most of that condition is in the rural communities and urban core, not evenly spread out. In Kansas, in the metro area, there's 16 clinics. 16 clinics that treat venous disease in some degree or another. Most of them are in Johnson County, by the way. So here are the risk factors: family history, medication, including birth control pills. So those of you in childbearing age need to be concerned about that. Women, primarily, obviously. Prior blood clots, family history of that, pregnancy, hormonal changes. This affects women a great deal. Since we're a country that's eating ourselves to death, obesity is a big deal. Okay, it blows out all the valves in your legs, so it is not efficiently returning blood to your heart. Lifestyle, tobacco use breaks down the collagen in your veins, so it allows the blood to backflow. Sedentary and diet. Exercise is very good as a way to slow it down. Prolonged standing, sitting, trauma, illness. A lot of people think that if you have diabetes, you're going to have this problem. Nay, nay. Diabetes and heart failure makes it worse and advances the progression of the disease, okay? So again, because diabetes and heart failure is directly related to obesity in this country, you're also seeing an increase in venous disease. And then there's surgery. Doctors, after surgery, will always give you a blood thinner. That's the reason why. They don't want you developing clots. Here are the numbers. 2 million Americans suffer DVTs, which are killers. Okay, that's basically the population in Kansas City. Oh, and in that group, over 200,000 deaths yearly. That's basically a population of Des Moines, Overland Park, 60,000 cases of pulmonary embolism. There was a case in the Kansas City jail recently that you read about on a teenage girl who happened to have a patch and had birth control pills also. You probably heard the story about Princess Diana when she had an accident. Here's the worst, besides DVT, the next worst condition is skin ulcers. Okay? Then you have stasis dermatitis, and these are the numbers affecting each age group. When you get to this, the annual case of stasis ulcers is 500,000 a year. Now, DVT kills 200,000. That's still a pittance compared to heart disease, which is about 800,000. Cancer, about 800,000. But this is a much more prevalent condition. 3 million annual workdays are lost, up to $3 billion in direct annual health care costs. The next stage that leads to those that you just saw is chronic venous insufficiency, blood not returning to the heart efficiently. All you have to do is walk to a Walmart pharmacy in warm months. People are in shorts and short skirts. Just look around you. I did a survey the last 2 summers. It's amazing how many of these cases I saw. Just amazing. 24 million Americans have these conditions. These, in the past, were considered cosmetic, but this is all part of the venous insufficiency problem. They're a medical condition. Okay? So why is it that we don't hear more about venous disease? Because, number one, it doesn't kill you, for the most part. Okay. But it makes your life miserable. Morbidity is very bad. Talk to anybody that's got any of these conditions, they'll tell you how miserable they are. If you ask family and friends, you'll be surprised at the responses. I bet you if I asked you folks to raise your hands, you probably know in this group people that have this condition. Many of you have early spider veins, for example. Okay, men, it's hereditary more than anything else. It's considered cosmetic in the past. Most doctors that you speak to really don't know how to deal with this problem. They say, oh, I see a lot of patients. I got a room full of people waiting to come in, but they don't know what to do with them. National medical initiatives, Surgeon General and the CDC have announced a call to arms. Primary care physicians are urged to screen for and address venous disease issues, but they're doing it inadequately right now. Major medical ongoing training organizations, doctors have to go in for classes every year to stay current. I worked with a group called American Venous Forum the last 4 years, and we went to medical conferences to teach doctors how to do this. Okay? So now there's a rising consciousness of this, but it's still not being addressed correctly because it's so fragmented. So our business opportunity is to establish a dominant national entity and brand identity in vein treatment and wound care clinics, which are being done separately. And then establish a turnkey mobile outreach services into the secondary communities that we just mentioned, because that's what's going to be needed. So that's it in a nutshell. We go to questions. Yes, Nate.
So you can talk a little. Could you talk a little bit more about what the treatment's like?
Sure.
And why your treatment at your facility is going to be, I guess, more holistic and better treatment facility than, let's say, St.
Sure.
Luke's.
Current availability of care, especially vein treatment clinics, are found only in wealthier urban centers like Johnson County. 14 of the 16 centers are in Johnson County. Okay? I take that back. 1, 2, 3, 4. 12 of the 16 are in Johnson County. Okay? And this is the reason why. They have insurance, and insurance pays for these treatments. Okay? St. Luke's has one. There's 2 centers, 3 centers altogether in Cass and Jackson. And that's pretty much it. None of them are in the urban core. None of them are in the suburban counties at all. All right? And none of them treat wound care and vein disease as one. It's not an integrated care. So if you have an open wound, they'll send you to a university or one of the hospitals. Why? Because wounds, every incident of wound care is about $40,000 per incident, and it's recurring. And the reason why it's recurring is they haven't dealt with the underlying cause, which is chronic venous insufficiency, most of the time. There are other kinds of wounds, but that's one, predominantly the one that we're dealing with. So we're going to integrate all of them because we feel that they're 2 sides of the same coin. Okay, you can't deal with one, not the other. My dad is a good example. He suffered it for 4 years, almost lost his foot. If he were still alive today, he'd be my first patient. We cleaned it up, and it will go away, and it will stay gone. I screened a lady from Russia in New York a few years ago as part of the screening program. And she'd been treated for 7 years. When she came in at the behest of her daughter, who had early signs of venous disease, they had me screen her. And I looked at her. She had open wounds the size of a baseball in her leg, going down to the muscle. It had not been dealt with for 4 years, and she lived in the U.S. after coming from Russia. Okay, and that's an example. And then when I did the ultrasound scan, I said, here's the reason why. I said, well, nobody's ever done that. Nobody's ever told me about this. I said, this will never heal until this other underlying cause is taken care of. Delivery of services is fragmented. Majority of the population is underserved. And major medical teaching hospitals only deal with wound care. When we went to KU, which wants to become a partner of ours, they only deal with wound care. They don't do any of the other venous treatments. So getting back to your question, Nate, venous treatments, here are the accepted state-of-the-art treatment. Use laser or radiofrequency fibers, and you ablate the offending vein, close it off. Used to be, you had to strip them out. Long recovery times, 8 weeks or longer. Now it's a 1-hour procedure. You go in, you get it done, you get up off the table, you're awake the entire procedure, and you go back to work. The same day if you choose to. If not, you take a weekend, go back to work on Monday. Okay? We did it with an 86-year-old woman at a clinic down here in Overland Park. The woman said to me, before she got off the table, she said, "This is the best my leg has felt. Can we do the second leg?" And we said, "No, we want to make sure your first leg heals properly. Bring you back." She said, "My God, I should have done this years ago." I said, "Well, we didn't have this procedure 12 years ago. Just got FDA approval in 2000 or so, give or take." Okay. Sclerotherapy, which was the accepted procedure for a long time, didn't have as good of results, but for some of the superficial things, we can do that. Microphlebectomy, where we do remove the veins that you see like this. Okay, these can be removed with microphlebectomy. Again, very simple procedure. It's done in the office, and it's taken care of right away. This lady has advanced spider veins. Yes?
So you said you're going to be sort of addressing the urban core
Correct.
and those without insurance.
Yes.
So can you talk a little bit about that and how you're going to make money?
Yeah, there are a couple of things that we're going to do. We're in an active process of getting government grants, so applying for government grants. This is a problem that is recognized by Medicare and Medicaid. Okay, but nobody wants to take care of those patients because in their mind there's not enough money in it. Well, if we partner up with major teaching centers like Truman, University of Missouri, Kansas City, and KU Med has already signed on. They just don't have the wherewithal, and they'd be very active participants. That's how we're going to make our money. Because you take care of one patient that's in this, they have other family members that do have insurance. Okay?
So
Yes.
how does the Affordable Care Act, as a healthcare entrepreneur, affect your business prospects, especially for going after the underserved markets you've identified?
It doesn't, and I'll tell you the reason why. Let me give you some numbers here. $60.5 billion, 2.5% of annual national bill. That's what it costs. This is number 5 on the list of top 5. But you know what? If you look at any statistical data, it doesn't even show up. Why doesn't it show up? It doesn't show up because it's not a killer per se. Only 200,000 deaths versus 800,000 in heart disease, 750,000 in cancer. Okay? But we, in fact, are just behind heart disease, cancer. Heart conditions is 95, 96 billion. Trauma is 74, 72, 72. And we're 65. It's not even mentioned. And yet we're just spending money, throwing money at it.
And out of those 80 million, you say if you have the problem, how many have been diagnosed? How many are getting treatment?
Excellent question. Last 2 summers, I stood in front of several major pharmacies. Just watch people coming in. Okay? I identified the ones that had these conditions because it's very apparent. You just go up to them and says, "Have you had this looked at?" "Yeah, I went to my primary care physician. He said, I've got the phlebitis and skin itch and all that." I said, "Okay, are you on anything?" He said, "Ah, gave me some medication, some blood thinner, diuretics, and that's it." That's it. Okay? So this continues, and their skin condition was getting worse. Absolutely getting worse. I'll bet you anything, many of you in this room know somebody that already has this condition in the family. If you have a mother, a father, women in particular, all right, on that side, major problems.
I think this is a much needed service with the local hospitals. I think from my perspective, looking at this, have you considered possibly the ROI directly to the hospital? We know that.
Well, that's a good question. That's a very good question. Are there any hospital administrators or affiliates here? All right. Let me tell you something about hospitals. I'm not going to disparage hospitals, but hospitals are not groundbreaking and pioneers. I'll give you an example. Almost 30 years ago, day surgery centers came into being, okay? They were primarily owned by anesthesiologists and surgeons because they saw a need for it. They saw a lot of these procedures done in hospital that didn't need to be done. So they started this. Hospitals didn't want to have anything to do with it. Why? Because it diverted their revenue stream. They thought it was just going to be a fad. In 5 years, they realized what a cash cow it was. They started buying up day surgery centers. There are no day surgery centers that are not hospital owned today in the Kansas City market. None. The last one in Liberty just got bought about 3 years ago. Okay? I know because I worked in that environment. Now, there's another service that was started by physicians. Bariatric surgery. We're a nation that's eating ourselves to death. Bariatric surgery is basically the last stop to mortality. That was started by surgeons about 10 years ago. In the Kansas City market, they were all owned by physicians. Today, there's only one left. All the hospitals bottom out. This service is the last bastion of revenue stream that the hospitals haven't got into yet because they don't know how to manage it. The only two hospitals in this area that have actually gotten into it reluctantly at the behest of the doctors, St. Luke's and Olathe Medical last year. So what we're wanting to do is establish a national brand identity, much like Discover Vision for LASIK surgery, in 17 retirement communities in this country, from Hawaii to North Carolina. And we have a plan for that. And in 5 years, if a hospital group like HCA here offers me a bucket of money, I'm going to say, okay, or we'll take it public. But there's a big need for this, and nobody's addressing it.
Richard, what is are you a medical doctor?
No, I'm a lay, you would call me a lay expert. I did my pre-medical, didn't go to med school. Great disappointment in my family. But I've stayed in healthcare. You know, all Chinese are supposed to be doctors and lawyers. Come on, and engineers, right? But I like the business side of things. I can see things happen. I was the first in Kansas City, and as far as I know, in the central states to start an integrated spinal orthopedic clinic. I was the first one to have acupuncture and all of that esoteric stuff. When I did that, everybody said, you're crazy. It never happened in Kansas City. Today, there isn't a place that you go to in Kansas City that doesn't have it, 20 years later.
One more question?
Yes.
What are your staffing requirements?
Well, right now, as a doctor myself, a couple of employees, but we have another site that we're planning in Blue Springs, and then, of course, Olathe, and we'll have other doctors have already indicated interest, so we have to work out all the agreements with them. Yeah, yeah. Dr. Brockenborough makes it interesting. Dr. Brockenborough is a cardiothoracic board-certified surgeon. He's one of the few that does this. And right now, there's very little regulatory requirements, okay? And that's one of the things that's attractive. You know, you want to try and keep the government out as much as possible. Now, there was a question earlier about affordable health care. We get affected by Medicare rates. Medicare reduces their rates every year by about 5%, give or take, okay? And we see the reduction of rates every year. But in our business plan, we've planned for that. But the numbers keep going up. Yes?
So, as a young person with healthy veins,
Mm-hmm.
can you talk a little bit about preventative care?
Yep.
And then when are you going to launch?
In about 30 days. We're in the final stages of getting our location ready, as well as getting certification for the doctors for billing purposes. And once that's done, we'll open our doors. We'll have a soft opening. Our website isn't live yet. It'll go live when we start seeing our first patient. So if you try to look us up, you're not going to find us. So give us about 30 days. Okay. Yes, question?
Yeah. Back to the VCCA, though, there are a lot of, it sounds like you've got a nice diagnostic model, nice, relatively standardized treatment methodology. So you really have a nice package. And one part of ACA accounts for a lot of innovative pricing models. Have you thought about doing things like the way I know Cleveland Clinic and some of the places with heart surgery just have a package price, covers the procedure, covers aftercare.
Yeah.
I mean, have you looked at some innovative,
Yes.
quality-driven rather than quantity-driven models?
Well, in healthcare, you are either reimbursed under the hospital model, which is quite a bit more, because they can bill you for everything, or you are in an outpatient setting in a physician office where there's a global package. They pay one fee for both the doctor's services and the procedural services, okay? And that is set by Medicare. And hospitals, not hospitals, but private insurance payers will pay about 60% more than what Medicare pays. Okay, so if Medicare pays in the Kansas City market is about $1,500 for this procedure that we're talking about. I'm just talking about the ablation procedure. I'm not talking about anything else. Ablation procedure, it's about $1,500 to $1,600. Private insurance will pay somewhere around $3,000 to $3,500. Now I have other facilities that charge more in different parts of the state and the country. In a hospital, the same procedure, they can charge up to $15,000 per leg, per vein, because they bill for all of the other ancillary services. So I would say to you, if you need a service like that, where do you want to go? Of course you want to go to somewhere that gives you the best care, but you want to pay $3,000 versus $15,000 because your out-of-pocket is going to be that much greater. Yes, sir.
Okay. I can talk loud enough. That's fine. I want to go back to Nate's question. If you have an educational program out there
Yes.
to help young people avoid this?
Yes.
Because that's how you're going to keep it going, because then those people are going to know people that need the treatment who aren't as far along with the problem.
Yes, we do. I'm sorry, I'm not going to get back to that slide in time. Our screening program, our preventative screening program, has an educational component as part of our outreach. We're going to go to Truman Medical, KU Med, we're going to go to Swope Health, we're going to go to physician offices, and we're going to do screening for DVTs, which is a killer and has been something that the Medicare, CDC, and the Surgeon General's office has wanted us to do. As part of that, we have a very nice screening summary that tells them what their risk score is and the things that they can do to slow the progression. Once you're on this road, you'll never get off of it. The only thing you can do is slow it down, okay? So if you hear the thing the doctors say that you have heart failure, when you start on that road, you're going to be on that road. All you can do is square up the slope. Same thing with this. You have to slow it down. So the things that you do is don't smoke, get the extra weight off, particularly in your stomach. Those people that are obese, 100 pounds or more, okay, definitely have this problem. I can tell you it's close to 100%. It's close to 100%. Exercise, walk. Walking helps because you're working the calf pump muscle. If you can run, run. But walk is the best thing you can do. Walk for half an hour every day, okay? And watch what you eat. If you eat the kind of foods that destroy your collagen protein structure in your veins, that's what causes this. If you're diabetic, get your diabetes under control. If you're on drugs for heart failure, you need to be very strict. Most of the people on heart failure are obese. That's all there is to it. Yes, sir.
Is there a business opportunity in the preventive side?
Yes, there actually is. And I'm meeting with somebody that's doing that now up in the northern central states about that. There are screening companies that do screening services, but this is an area that they haven't really touched in. They're doing other kinds of screening. They're doing heart disease, they're doing carotids, they're doing arterial, but they're not doing venous. So yes, there can be, but we look at it as a way to reach out to people that currently don't have the service, okay, as part of it, because they will end up being our patients. Because the first time anybody has, spoken to them and said, you've got this condition, if you take the pills, it won't help you long term. You need to do this.
So you're looking to get into educational facilities and retirement homes. Can you talk just a little bit about the mobile clinics that you mentioned at the beginning?
Okay.
And is there a separate revenue model for those mobile clinics? Because I assume you're going into the urban core, not at a wealthy retirement home.
Correct. Well, with the retirement homes that we're going to partner with, these are skilled nursing facilities. So we are going to do preventive screening on every person that comes in, because most of those people have, at some degree, a problem already. So we're going to give them an early diagnosis, if you will, okay, so they're aware of that. And if they end up being in a chronic situation, we can actually chart their progression. Not everybody that has this condition, particularly early, is going to need treatment, interventional treatment. We can do some early treatments, medication, stockings, lifestyle changes, all of that. So yes, we can do that, but the mobile piece actually not only goes out to the communities, we can actually go to these nursing facilities, retirement facilities to do that. And that's currently not being done, or done very poorly.
All right, everybody, let's give Richard a big round of applause.
Thank you very much.
Sorry to keep you a little late today, but that was extremely educational. I hope that you learned something. You guys are dismissed. Please come back next week. We're going to have our first startup from the Valley visiting Kansas City, and KC Bike Share. So check the website, 1millioncups.com, for the schedule, and please join us and apply to present at Startup at Kaufman Demo Day during GEW. Thanks, guys.